I'm Amelia Randall, the clinical lead of the Mendip COVID vaccination service. So we've been using lay vaccinators at Mendip for a couple of months now, and we've all agreed it's been a really positive experience. We've had lots of people approach us interested in becoming involved. Started off with some of our marshals who have seen the vaccinating going on and shown a sort of tentative interest in becoming more involved, and the word spread, and now we've got a really strong team of about 30 lay vaccinators working for us.
I joined the mass vaccination programme in December. I work for the airlines, and a lot of crew were talking about how you can join this mass vaccination programme. So I joined it through the NHS professionals, and after a lot of e-learning online, I finally got a training course, and here I am today at Mendip, vaccinating all these lovely people who are so grateful for what I'm doing.
I'm a retired veterinary surgeon. And I heard about the opportunities to be involved in the COVID-19 vaccination programme at some point in the autumn, and put my name forward. Get tremendous support here from the NHS staff, the doctors and the nurses and pharmacists, who are all full of good advice and very helpful and very positive.
The success of this programme is important not just to me personally, but to the rest of our country and all countries around the world. I've been amazed at the enthusiasm of all the other lay vaccinators here, but also the welcoming nature of all of the health professionals that have taught us along the way and offered encouragement, and not least, of course, the people that are receiving the vaccines.
I started about 6-7 weeks ago when I was marshalling, and I happened to mention to the lead clinician I would like to do some vaccinating itself. There followed some training and some practical training, and 5 weeks later I'm now vaccinating the public who arrive here at Mendip. I've just vaccinated somebody called Brian. He's gonna be interviewed very shortly, and he can tell you about his experience here at Mendip.
I've just come back from my vaccination. It was very well organised. It didn't take a couple of minutes just to ask a few questions, and then when we'd had the vaccination we didn't even know it had been done. It was painless. People were very, very helpful, very kind and very well organised.
I've been involved in working with a number of lay vaccinators and training up some, and I think they're great, and shown they're very professional, very good with people, so I think it's an excellent solution, and I would certainly be happy to work in any centre that had a high proportion of lay vaccinators.
I've been working with lay vaccinators who have been trained up here, and they have been great to work with. They, I think, have very good training here and have developed the confidence. If they need any support, we are a mixed team, so there are doctors and nurses who are experienced who can give them any support that they need.
I also have trained as a lay vaccinator. I trained from the very early days. I do a lot of management of projects of medical teams, but I felt to really understand this and make sure we supported the staff and I understood the operation and the models that I could develop, then I ought to train myself. The training is really robust, it's secure, it's supported by some fantastic clinical leads around us, some incredibly confident and truly competent lay vaccinators. That means we've been able to deliver a very flexible model and hit the record vaccinations that we have been able to deliver.
We pair a lay vaccinator up with a registered clinician, and so as soon as they start, really, they're able to be supported. It takes a range of different amounts of time for people to become confident, but universally they have all adapted to it really, really well and been extremely pleased with themselves for what they've achieved, and now being able to be a part of such an important part of our recovery from coronavirus.